We've all heard that you can't overfeed a baby, but what if I told you this is actually a myth? Welcome to episode 3 of Milk MythBusters, a series where we go over common breastfeeding myths. If adults can eat too much and feel uncomfortable, why wouldn't this be true for babies? When babies are direct breastfeeding, they stop eating and sucking once the drive to eat decreases. This allows time for their tummy to tell their brain that they're full. Since the vast majority of people produce about an ounce to an ounce and a half of breast milk per hour, the amount of milk that's available to babies when they're direct breastfeeding is rarely over 5 ounces. This is why the American Academy of Pediatrics recommends keeping bottle amounts to 4.5 ounces all the way up to 12 months of age. Overfed babies act very similarly to hungry babies. That crying and irritability is often mistaken for being hungry. Babies also often cry with transition, so taking away that bottle may cause them to cry, but it doesn't necessarily mean that they're still hungry. Overfed babies are also more likely to have stomach and gas pain, which causes them to cry more often. Their tummies are usually pretty hard and they might have a lot of reflux or spit up or diaper blowouts. Because sucking is so comforting to babies, they may start to want to feed more often, and then they associate eating with being comfortable. Bottle feeding takes much less effort than direct breastfeeding, so babies may not pull away to indicate that they're full. Over time, this causes the satiety response, or the feeling of being full, to be suppressed. Infancy is the period where behaviors and things like hormonal control and levels are set. Because some of these natural responses are suppressed in bottle-fed babies, this is what puts them at that higher risk for obesity and diabetes. This suppression can also happen in direct breastfed babies whose parent has an oversupply. What breastfeeding myth should I go over next?